Injuries to other structures. In this module, we'll focus on some of the other types of injuries that you may encounter in your clinic and how to proceed with them. We've already focused on some of the major ones you'll see, focusing on muscles, tendons, ligaments, and bones, and these cover some of the other types of injuries. What we will cover. We'll recap on some of the learning of the level 3 soft tissue injuries to joints and learn in detail a bit more about menisci and cartilage injuries. We'll discuss the types of injuries, the physiological changes that may occur in the spine, such as degeneration and disc injuries. And then we'll learn the sports massage guidelines for working with clients with these types of injuries. Let's start with bursitis first of all. So bursitis may be classified as a frictional bursitis, where friction has irritated the bursa itself. Chemical or septic, where an infection has occurred within the bursa, creating that inflammation. It's something that can occur on its own, especially a frictional bursitis, or it can be part of a generalized inflammatory or infection. It can be often alongside conditions such as rheumatoid arthritis, tuberculosis, and also ankylosing spondylitis as well. So all of those inflammatory conditions, you may see bursitis alongside that. If you're working with a client that has been diagnosed with a bursitis, always ask them what type of bursitis that they have, and you want to make sure you can rule out any of those other conditions as well. And if it hasn't been picked up by their health professional, then let them go back to the health professional, send a referral so they can get that proper diagnosis with everything else. Frictional bursitis is one I think you would see most commonly within your clinic, and this is caused from an overuse, where the tendon moves repeatedly over a bursa, so often caused by repetitive movements or repetitive motions. The irritation from the tendon stimulates an inflammatory response, which then causes fluid to be secreted into the bursa, creating the swelling. The signs and symptoms that you may see with the bursitis is swelling, tenderness, redness around that bursa area, and also pain on movement. So when that muscle is contracted, it can affect the bursa, which creates a pain response. The next injury we're going to look at is a menisci injury, and this is one of the most common knee injuries, where there are lesions that occur on the medial or the lateral menisci, and those lesions can vary in shape, size, length of the lesion, and also how much of the menisci is affected. Some of the signs and symptoms from a menisci injury may be pain on movement, stiffness around the joint, around the knee, inflammation, and a client may experience or report the feeling of the knee catching or locking or even giving way. The next type of injury is a cartilage injury, and this is where there is an injury to the articular cartilage, which can be caused by a distortion, dislocation, or a contusion of the joint. They're often associated alongside ligament injuries or a subluxation, so a dislocation of the joint itself. They may also be caused by repetitive microtrauma to that particular area. The signs and symptoms of a cartilage type injury may be pain on movement, inflammation and swelling around that area, tenderness also. The guidelines for working with clients with joint injuries. It's important to take a really good client history to find out all of the factors involved, especially if you suspect a joint type injury. Once you have done your objective assessments, including the injury assessments, and there is pain present, then refer them for diagnosis if they haven't already been for a visit with a health professional, whether it's their GP or a physiotherapist. You want to also consider why it has happened and what has happened based on those subjective factors. Always ensure you screen deeply for any red flags and any unexplained symptoms if there is maybe a bursitis alongside an infection or an inflammatory disease. If a joint injury has been diagnosed, they may have had a steroid injection depending on the type of injury, and massage is a contraindication for 7 days after that injection. When you see your client and they have had a diagnosed injury, assess their posture and range of motion. Always check for signs of inflammation and any other local or systemic contraindication. So you keep checking to make sure that they are safe within the sports massage remit. And always refer if there's any further assessment that's required or anything that's cropped up later down the line in your assessments. Next, we're going to look at some disc and spine injuries. Now, back pain is really common and very prevalent, and the percentage is very high if people experience back pain throughout their life when there is no damage or tissue injury that has occurred. But it's always worth knowing that there is possibilities that injuries to the disc and to the spine can occur when it comes to sports massage. So with a disc herniation, there are many stages to that herniation, and it starts with degeneration, which happens as we age to everybody, unfortunately. The next stage is a prolapse, where the disc has just started to protrude out slightly towards the borders of the vertebra. Then there's an extrusion, which it goes right to the very edge of the border of the vertebra. And finally, a sequestration, where the disc has completely come out of the side of the vertebra and has passed the vertebra borders. Now, if your client has had a disc herniation, the chances are that they have had an MRI, especially if they've had anywhere from a prolapse to a sequestration. But they may have had a MRI scan if they have had back pain, and they may have been diagnosed with some degeneration of the vertebra or of the disc themselves. And just to note that back pain doesn't always occur when there is a prolapse to the disc themselves. It could be completely separate, irrelevant of the tissue damage. This is a really interesting study on disc degeneration. And this study was created in 2015, and what they found was that disc degeneration in asymptomatic individuals, so people that weren't experiencing any symptoms, increased from 37% in 20-year-olds and to 96% of 80-year-old individuals. So as time went on, that disc degeneration increased as we aged, which we know that's what happens as our body ages. The disc bulge prevalence also increased from 30% to around 20 years of age up to 84% of those that are 80 years of age. So again, there's a growing change as the body changes as we age. And the same with disc protrusion. So that increased from 29% in the 20s up to 43% in the 80s. You may be working with clients or have worked with clients already that have had an MRI for back pain, and then have come to you and then have said it's because they've got degeneration to their discs. Now, depending on their age, it can be quite normal for that degeneration to happen, and it's never really a correlation between that and back pain. So it's worth noting that when you're working with your clients that have had an MRI. This quote is really interesting, which came from the study. Imaging findings of spine degeneration are present in high proportions of asymptomatic individuals, which means it's often found and quite high in people that don't have any symptoms of back pain whatsoever, and it does increase with age. Many imaging-based degenerative features are likely to be a part of normal aging and unassociated with pain, and I think that's really important when we educate our clients that have had an MRI or want to go and get an MRI for some back pain. If you've done your assessment with them and you've discounted any red flags and they're still experiencing pain, it's always worth sending them to a health professional first of all, just to have everything checked out. And they may send them then for an MRI, but the MRI doesn't really equate to what may be happening in terms of a pain response. So once they've had that diagnosis, then you can start working with them in a sports massage capacity to get those tissues relaxed, to calm the nervous system down, to help them then build strength in the area, which will most likely help reduce back pain. And this is not to say we're going to disregard or discount any MRI findings. It's important to have that information, but it's also worth noting that some of the findings within an MRI may not equate to the pain that your client has been experiencing. When it comes to sports massage, here are some good guidelines to follow. Take that good client history to find out all of the factors involved. And if you suspect any type of spinal injury, refer them instantly for diagnosis. That's really important. Other considerations to follow is what may have happened and why has it happened. Screen really deeply for any red flags, especially if there's any unexplained symptoms and lower back pain, so any loss of bowel or bladder function. So go back to that contraindications PowerPoint within your level 3, and you want to discount any of those red flags. If your client has been diagnosed with a particular injury to the spine, assess posture, check for range of movement, and also always check for signs of inflammation, any other contraindications that may be occurring, and then always refer back for further assessment if you aren't quite sure. So what is our goal when we're trying to work with clients that are experiencing back pain, but also other joint pain? And I think our goal is to help that client through the healing process and their rehabilitation, whether it's from an exercise perspective, a movement perspective, or post-surgery. The reasoning for sports massage can really help with any joint injuries and spinal injuries. It can help reduce pain to the area, calm that nervous system down, to be able to help that client then begin to increase range of movement and create a pain-free window for that home care. That's really important when it comes to rehabilitation after a joint injury and also after a spine injury. If the client has been experiencing a bursitis, then release work on that muscle and tendon can really help reduce that friction to the area of the bursa. Massage around the spine may help calm that nervous system down if there is pain, if there is some degeneration of the spine. Let's look at sports massage guidelines for general injuries within the phases of tissue healing. So within the bleeding, the inflammation or the acute phase, that's a phase where the menisci injury may have just happened, the bursitis may have also just happened, or there's that inflammatory response around that bursa. Or in terms of back pain, it may be that there is an acute episode of back pain and they've just been recently diagnosed with what may be happening. Always begin with ensuring clients follow the Do No Harm policy and avoiding anything that can impact the injury more negatively. And then follow the PEACE acronym in this early phase. When it comes to particularly joint injuries, the physiotherapist that you refer them to or back to their GP, they will probably follow this protocol. But it's important to have this in mind if they come back to you once they've had that diagnosis. During this time frame, so we're going to focus on PEACE, there may be some scope for some passive range of movement that is mid-range to an active range where it's tolerated. And that's really important that you link up with the physiotherapist during your client's recovery to know what you can and what you can't do based on what they've found and based on their diagnosis. And general massage should be avoided in that injury area. So avoiding massage around the knee if there is any, or any other joints if there is any inflammation that is present. As we move along the time frame into sort of 3 and 7 days, some more passive movement may be beneficial, but maintaining that mid-range to an active range. You can apply general massage around that area of injury as long as there are 0 signs of inflammation and swelling. If there is, then that needs to be avoided. In this phase, you can also use some muscle energy techniques where tolerated, where there is no pain on contraction, which can help reduce some of that tone around the area, especially if you're working on an area where there's been a bursitis caused by friction. Positional release during this time is a really gentle technique to help affect the nervous system to reduce, calm and restore ease, but also improve range of movement at that joint if that has been affected. As we move into the proliferation and the repair phase, we can add some further techniques to this area. We can focus on that love part of that acronym during this phase. But as we're working with spine injuries and joint injuries, then always refer back to that physio for support and guidance within your treatments to ensure that you're working alongside the physiotherapist with the exercises and work that they are prescribing for your client. Within that 7 to 21 day time frame, we could focus on adding more passive, active and resisted movements to the massage where it's tolerated. You can continue with some general massage into the area of the injury as long as there are no signs of inflammation and swelling. You can continue with your muscle energy techniques. And then also soft tissue release, both transverse and longitudinal, may be appropriate for the particular area, depending on what is happening, as it can increase and improve that proprioception to the area and also range of movement at that joint in particular as well. And as we move into the more remodelling and maturation phase, we can start to add a few more techniques into here. And this can go anywhere from the 21-day mark right through to 12 months. The general massage of the area of injury, depending on what's happening, can definitely help restore ease to the area. There may be some trigger points on bands of tissue localized to that injury, but also more compensatory patterns that may help reduce pain. And some friction massage may be used, especially to the tendon around the area, to stimulate that connective tissue remodeling to help recover from an injury. And you continue to add in the muscle energy techniques and soft tissue release where appropriate. As with everything, think about that whole body approach and what may else be happening. Make sure you assess your client's posture, movement restrictions that may be contributing to the aggravating factors and should be considered as part of the whole treatment plan. And if there's anything you aren't sure about, always refer on, especially when you're working with joints, as they will need physiotherapist attention before sports massage can be applied. Other modalities that may help if you are qualified in this area, you can use things like kinesiology taping to help with pain reduction, and also instrument-assisted massage work, which allows pain reduction to help with improved movement. So if you're qualified to use instrument-assisted massage with movement and kinesiology taping, then you can add these into your practice. Guidelines for home care. It is really important that you work alongside a physiotherapist, strength and conditioning coach, or a personal trainer that can deal with rehabilitation to create a detailed home care plan for clients experiencing joint injuries. You can suggest some pain-free cardiovascular exercise to keep that client moving, to help with vascularization, and continue to communicate with your clients in a simple and clear way about their tissue healing education and keep focus on their outcomes rather than tissue healing times. And here are some further reading and resources based on this presentation.